This is a presentation on premenstrual syndrome, which commonly affects women in their reproductive age group. I'll be talking on definition, diagnosis, classification, and management of premenstrual syndrome. Premenstrual syndrome is a condition in which woman gets physical and psychological symptoms which is present during the second half of a cycle. Core premenstrual disorder is the most commonest type of premenstrual syndrome. It starts from the day when the ovulation happens and it abates when the menstruation starts. The diagnosis depends on maintaining a daily record of severity of problems over 2 cycles. The symptom diary is maintained by patients. GPs can manage patients with premenstrual syndrome with simple measures like birth control pills. Management is broadly categorized into complementary therapy and cognitive behavioral therapy, medical and surgical management. Medical management is further divided into non-hormonal and hormonal treatment. Hormonal treatment of premenstrual syndrome includes giving birth control pills. The catch is to avoid progesterone as it is the cause for it, and GnRH injections are an advanced form of treatment. Non-hormonal treatment includes serotonin reuptake inhibitors and noradrenaline reuptake inhibitors. Hysterectomy, removal of the womb with removal of bilateral tubes and ovary, is an ideal surgical management for treatment of premenstrual syndrome. And other surgical options apart from hysterectomy with bilateral removal of tubes and ovaries are not recommended. HRT should be given after the surgery to patients who are less than 50-year-old. Testosterone can be safely given without any restriction. For patients who have premenstrual syndrome, when they're trying to get pregnant, it is recommended to stop SSRI or SNRI prior to getting a pregnancy. It is vital to ensure that none of the patients receive only progesterone treatment for premenstrual syndrome. In short, premenstrual syndrome affects women by causing breast pain, body swelling, leg cramps, mood instability, tiredness, and a lot of other symptoms that can affect their daily quality of life. The treatment is summarized in this flow chart from a simple measure to the surgical treatment of removal of tubes and ovaries along with uterus. Thank you so much.